My name is Kevin Luters. I'm with Bell Medical, and I'm pleased to introduce you an in-service on the 450X. The 450X Stimpod is the only handheld quantitative train of 4 device that at the simple change of a cable can do acceleromyography or electromyography. So to start off, we're going to power up the system, and the system will first ask you to insert a cable. At this time I have a choice of EMG or AMG or acceleromyography. I'm going to insert the acceleromyography. Now I have the word Stimpod there. So I insert that cable. Now it would ask me it says that I have an open circuit. So I connect the circuit, and now it basically asks me, do I want to determine SMC, yes or no? SMC stands for super maximal current. It basically is determining what is the ideal current for this setting. So if I say yes to that, I would just press select, and it's going to go through a little exercise to determine what is the ideal milliamps. You do this test prior to delivering paralytic. In this case, it found me at 45 milliamps, and now it's going to do a train of 4 in about 8 seconds at 45 milliamps. And this puts it in an auto mode that will automatically do train of 4s depending on what it senses. So in this case, it did the 4 twitches and found me at 123%, and I don't have any paralytic on board, and I'd be safe to extubate. You notice it has a clock over here that I can adjust by pressing this button and going to 15 seconds or 30 seconds. There is another train of 4, and I'm at 87%. So basically that's acceleromyography. The nice thing about our acceleromyography is that this sensor can be put on this way. It's a 3-dimensional sensor. That way, I'm going to take it out of this mode and go to train of 4 mode. But it can be put on in multiple different ways. It can be on the fingernail, on the fingerprint, or on the side. So it's a 3-dimensional self-calibrating. Every time it does a train of 4, it self-calibrates itself. So if you wanted to not use that auto mode, you would just press the menu key and it would come straight to train of 4. In fact, we can inactivate the auto mode if one wanted to do that, so that it just powers up to train of 4. So now I have it at train of 4, and I'm at 45 milliamps. If I wanted to go down to 35 milliamps, I would adjust it by spinning the wheel, and then I would press enter. If I don't press enter, it'll go back to what I had at. So in this case, I'm going to go back to 30 milliamps. I'm going to press enter. Now I'm at a train of 4 milliamps of 30 milliamps. I'm going to do a train of 4. Shows I'm at 111%, which means I obviously don't have any paralytic on board. If I wanted to do a repeat timer, I would press and hold the stimulate button for a full 1.5 seconds, and it'll bring up a timer. So if I hold this for 1.5 seconds, you'll see a timer will come up, a little clock, and it shows that in this case I have 15 minutes. Now I can press because that's highlighted, I can press this enter key and go to 15 seconds. I can go to 30 seconds. I can go to 1 minute, 2 minutes, 5 minutes, 15 minutes. So I have control over the time that it's going to take. If I want to get out of that repeat timer mode, all I do is press the menu key or press the stimulate key again for a full 1.5 seconds. In this case, I'm going to press the menu key, and that brings up post-tectonic count. Post-tectonic count automatically does 5 seconds of tetany followed by 20 twitches, and it gives you the count over there. So if I have a count of like 5 or 6, it's going to be a while before I get that first 1 of 4 twitch. If I have a count of 16, I'm going to get closer to having that first 1 of 4 twitches. So I'm not going to demonstrate post-tectonic count. So once again, when you power on the device, it'll ask you to do, if you want to do SMC, if you haven't delivered the paralytic. But if you don't want to do that, you just want to do train of 4, you just simply press the mode key and it brings up train of 4. And then likewise, I can press it again and do a post-tectonic count. So if I take off this sensor and I do a stimulation, hopefully I can show what it would look like 0 of 4 by not touching. So there would be 0 of 4, and that would be for a paralyzed patient. Obviously, if I got 1 twitch, it'd say 1 of 4, 2 of 4, 3 of 4. As soon as it gets to 4 of 4, it will then give me the ratio between the 4th twitch and the 1st twitch, and that's our train of 4 ratio. That's acceleromyography. This sensor, we have a longer strap, a 5-inch strap that'll work on big thumbs or on the tibia nerve and big toes. This strap can be removed from the sensor, and the sensor can be placed on the eye, so you can do facial nerves monitoring the eyelid or the eyebrow. So that's our accelerometer. We've introduced, this is a 5th generation version of our 3-dimensional accelerometer. It is 12 times more sensitive and 10 times higher resolution. So we make the best in the business acceleromyographer, and it is extremely accurate. However, we have another mode called EMG, or electromyography, and when I connect that cable, it automatically says EMG and it's ready for EMG. To put our EMG cable sensor on, it shows you in our system pictures of how to connect it, so it's real easy on the packaging. But basically what I want to do is I want to take off, it's got a little crease here, so I want to take off the front portion, and these leads would go on the side of my thumb. And be aware, some of the other competitive devices use the index finger. We use the thumb as a reference. Then you put the EMG electrode on the abductor pollicis, which is that tissue right there on the thumb. Then you peel the rest of the electrode off, and you want to be about 2 centimeters from the crease of the wrist along the ulnar nerve. Now, I've used this sensor multiple times, but it'll work great for me. And this EMG sensor is ideal for robotics cases, and it's ideal for tucked arm cases. It's extremely accurate and considered the gold standard of quantitative train of 4 monitoring. So when I do a stimulation here, even though you see my thumb move, it's not based on motion. It's based on electrical activity in the muscle. And I'm at 96%. Once again, I don't have paralytic on board, so I'd be safe to extubate. One of the things I would point out, whether you're in the AMG mode or the EMG mode, whatever milliamps I have set, it will display the milliamps over here. So it'll say 29. In this case, I have 30 milliamps set, and it delivered 29.62 milliamps. So you never have to shock yourself. Be aware that the device will go up to 80 milliamps. Typically, the handheld devices that you're used to using that you dial up to 10, those deliver 70 milliamps. The ideal milliamp mode that you would typically use for a patient, whether it's EMG or AMG, would probably be 60 milliamps. But that's up to you, your clinical usage. But 60 milliamps is plenty. So I am at EMG again, and once again I can use the repeat mode, I can use the automatic mode. In this case, I'm going to turn my hand over and try to limit my motion. Even though my thumb moves, this would be simulating a tucked arm position. Now, that's not necessarily a scientific way to show that, but that shows you that I did get 4 bar graphs and I'm 108%, which means I obviously don't have any paralytic. Some of the things I would have pointed out to you is that you get 4 green lights here and you get 4 green lights here. And it tells you that you're delivering your train of 4. I have 30 milliamps here and I'm delivering 29.64 milliamps there. We do have a new IV pole mount, and that is attached with this clamp here, and it's nicely set up so that you can attach it to, and it has multiple tips. We call it the infinity because it has multiple ways for it to be attached and utilized. What's nice about it is you can still pull off the device easily and work it in your hands and then put it back if you need to. We also have a communications cable that will allow us to communicate directly to like a Philips monitor, and all the information that's on this display will also be on your Philips monitor. We can also communicate to a GE monitor or really anybody's monitor, and through those monitors we go to Epic and Cerner and those electronic medical records. So the Stimpod 450 has the ability to do EMG and AMG with a simple change of a cable, and we're excited to have you do a trial or a evaluation of the Zavant Stimpod from Bell Medical. Please call us. Thank you.